In a world overrun with the fake, delusional, and disingenuous, he stands as a beacon of truth. He is Abuki Cabal. You are listening to Abuki Cabal.
Welcome to the Abuki Cabal Show.
What's going on, everybody? Welcome to the show. I want to thank everybody for all of, the donations and support of the channel. Appreciate you guys' interest in the topics that I cover here. Tonight we're going to talk about a little bit more of the snake oil salesmanship that's going on out here in the States regarding people preying on people's fear and lack of education with regard to virology and medicine in general. You know, there's a lot of hocus pocus-ery going on around out here. And I'm going to focus on a couple of individuals that have been taking advantage of people that I was looking around and found, since my last coverage of the doctor down in Houston. So we're going to take a look at this doctor. Well, actually, we'll take a look at the nurse first. Okay. Got the nurse here who was charged with making fake COVID-19 vaccine cards. Okay. A nurse in Columbia, South Carolina, has been indicted by federal grand jury on charges of making fraudulent COVID-19 vaccination cards. According to the U.S. Attorney's Office for the District of South Carolina, Tammy McDonald, 53, is charged with making fake vaccine cards on June the 20th and July the 28th, allegedly filling out vaccine cards for people she knew had not received the COVID-19 shot. She's then accused of lying to federal agents when questioned about the matter in October. She's provided CDC COVID-19 vaccination record cards to individuals and had personally filled out the individuals' identifying information and lot numbers for vaccines she knew had not been administered to those individuals, the indictment said. McDonald has been charged with 2 counts of producing fraudulent identification documents and 1 count of lying to federal investigators. According to the indictment, she was arraigned Friday and granted a $10,000 bond and has pled not guilty on all charges, according to a press release from the U.S. Attorney's Office. Although the indictment speaks for itself, creating fraudulent or fake vaccine cards for those who have not been vaccinated poses a direct threat to the health of people in South Carolina, acting U.S. Attorney D. Hart said in a statement. According to the U.S. Attorney's Office, McDonald faces up to 15 years in prison for each count of making fraudulent COVID-19 vaccination cards and 5 years in prison for lying to federal investigators. Okay. I don't know if we talked about this before, but due to people's apprehension, they feel that they can go out and just get a card, just put information on it and, be okay. Some people are out here selling these cards. I've heard of people in various cities talking about, what they were going to do as far as getting a fake card so that they can travel, so that they can eat in restaurants and whatnot. And, I'm just here to say it's not worth it. It's not worth it. You'll be, sitting in prison somewhere, and in prison, you're not going to have any choice. They will administer the vaccine in there, whether you like it or not, and you'll be in general population out there. And imagine being in general population in a barracks setting with, hundreds of guys, there's all kinds of communicable diseases that run rampant in the prison system, hepatitis, HIV, staph infections are rampant in those situations, not to mention respiratory situations and infections, diseases, and whatnot. So, it's just not a good place. Anytime you're in a situation where you're in a close proximity to that many people, things get passed around quite easily. So we'll move on to the next story we have here. And I actually got another article that probably gives a little bit more information on Tammy here. Yeah. Okay. Here's the other one on the Hill. A nurse in South Carolina has been accused of creating fake COVID-19 vaccination cards and lying to authorities when approached about these allegations. As a state newspaper reported, Tammy McDonald, a registered nurse and director of nursing at a rehabilitation center. Wow. Ooh. Was indicted by a federal jury on November the 23rd, per court documents that were made public on Tuesday. She has pled not guilty to the charges. McDonald's attorney, Jim Griffin, Thursday claimed that his client, who he described as a very qualified and competent registered nurse, had created just one or two vaccination cards. He added that McDonald had used the cards to help a family member who has anti-vaccination beliefs, and that the family member did not pay McDonald, who herself is vaccinated, for the cards. Okay, I mean, why would you do that? Why would you, aid and abet an anti-vaccination family member because they have, unfounded beliefs about COVID and the vaccine? Why would you do that? And why would you have you say that you're not guilty, but then you have your lawyer come out and basically admit to the public that you did make one or two vaccination cards? Why would you make two vaccination cards for one person? The story just doesn't make any sense, but let's move on. It is unclear if McDonald used a real vaccination card or filled it out with false information, or if she made one from scratch. According to the indictment, she lied about the cards when confronted by agents for the FBI and the U.S. Health and Human Services Department, the state reported. So she lied to two federal agencies. Okay. McDonald is believed to be the first person in South Carolina to face federal criminal charges for the creation of false coronavirus vaccination cards. If convicted, McDonald faces up to 15 years in prison, though the newspaper noted that she will likely receive a lighter sentence because she does not have a criminal record. But she's probably still going to lose her license, or she's going to be fined heavily and be under supervision for a while. Probably not be able to hold any kind of management positions if she is, which is going to be tough for her as an RN. Okay, according to Johns Hopkins University COVID-19 tracker, about 53% of South Carolina's population is currently fully vaccinated. Reports of fake or fraudulent COVID-19 vaccination cards have sprung up across the country since the U.S. vaccination rollout began. Okay. In Michigan, 2 individuals, including one nurse, were charged with selling real COVID-19 vaccination cards that were taken from a Veterans Affairs hospital. That's going to be a real juicy charge right there. An Illinois woman was arrested after she attempted to enter Hawaii without going through a 10-day quarantine by using a vaccination card that stated she had been immunized with the Moderna vaccine. Authorities had repeatedly warned that using or selling fraudulent vaccination cards that misrepresent the official seal of the U.S. agencies such as the Centers for Disease Control and Prevention could result in thousands of dollars in fines and years in prison. So they're getting serious about this, y'all. Very, very serious. And like I said, it's not worth going down that road and trying to misrepresent your vaccination status for the sake of going out and eating in a restaurant or going to travel or whatever the case may be. This disease is real. You know, I've given up on trying to convince people, that the effects of this disease are dire. You know, people are attacking nurses. People are out here doing very stupid things. You got people who are having limbs amputated because once they get it, they're having, circulatory compromise and whatnot. And, still don't believe it until, they get into that situation. And the numbers are not lying. I mean, the people who are being treated in the emergency rooms and in the ICUs right now, 90% of those people, above 90%, I mean, it's higher 90% levels, 98% of those people are unvaccinated. I mean, you can't make those numbers up. And it's the same numbers around the world. So, like I said, I'm just here to present the information. I'm not trying to, convince, people who are adamant that they are not believers in science or the efficacy of the vaccine or vaccines. But I will continue to do some reporting on this and try to reach as many people as I can. One other individual here that I think you guys will find interesting. I found this on the Department of Justice page. A woman was arrested for fake COVID-19 immunizations and vaccination card scheme. California licensed naturopathic doctor, natural treatments for ailments, was arrested today for her alleged scheme to sell homeoprophylaxis immunization pellets to falsify COVID-19 vaccination cards by making it appear that customers had received the U.S. Food and Drug Administration authorized Moderna vaccine. So she was baiting and switching. Okay. Her name is Julie A. Mozzie, a 41-year-old of Napa, is charged with 1 count of wire fraud and 1 count of false statements related to healthcare matters. The case is the first federal criminal fraud prosecution related to homeoprophylaxis immunizations and fraudulent Centers for Disease Control and Prevention COVID-19 vaccination records. So this was the first one, and this was in July the 14th of 2021. Okay. The defendant allegedly defrauded and endangered the public by preying on the fears and spreading misinformation about FDA authorized vaccinations while also peddling fake treatments that put people's lives at risk. Even worse, the defendant allegedly created counterfeit COVID-19 vaccination cards and instructed her customers to falsely mark that they had received a vaccine, allowing them to circumvent efforts to contain the spread of the disease. The Deputy Attorney General, Lisa O. Monaco, the Department of Justice, and its law enforcement partners are committed to protecting the American people from fraudsters during this national emergency. This commitment is evident in this prosecution and as well as in the ongoing work of the department and our agency partners in the COVID-19 Fraud Enforcement Task Force established by the Attorney General earlier this year. So they formed a task force, which means that they have to get out here and get after it because they got funding to keep going. So they're going to be coming for y'all. You know, if this is what you're doing, they're coming for you, and they're letting you know with this statement here. Okay, according to the court documents, in April 2021, an individual submitted a complaint to the Department of Health and Human Services Office of Inspector General hotline stating that family members purchased from Mozzie COVID-19 homeoprophylaxis immunization pellets. The complaint stated that the family members had told her/him that Mozzie stated that the pellets contain the COVID-19 virus and would create an antibody response in the immune system. The complaint reported that her/his family did not receive the injections of any of the 3 FDA authorized COVID-19 vaccines. Okay. However, in connection with the delivery of the homeoprophylaxis immunization pellets, whatever that is, I've never heard of a homeoprophylaxis immunization pellet. Wow. Wow. Mozzie sent COVID-19 vaccination record cards with Moderna listed to the complainant's family. Mozzie allegedly instructed the complainant's family to mark the cards to falsely state that they received the Moderna vaccine on the date that they ingested the COVID-19 homeoprophylaxis immunization pellets. Wow. Pellets. I don't know. Long as I've been a nurse, I've never heard of a person taking a pellet. But hey, I guess that's how they get down in California. Steering through the challenges presented by COVID-19 requires trust and reliance on our medical professionals to provide sage information and guidance, said Acting U.S. Attorney Stephanie Hines of the Northern District of California, according to the complaint. Instead of disseminating valid remedies and information, Julie Mozzie profited from unlawfully peddling unapproved remedies, stirring up false fears, and generating fake proof of vaccinations. We will act to protect trust in the medical developments that are enabling us to emerge from the problems presented by the pandemic. Okay, I told you guys about these snake oil salesmen, man. They're out here shaking snakes and, having their friends come out and, lick on the snake's back. And then next thing you know, they're cured and, their hair is no longer gray and all of that. And, and there are people out here falling for it, man. Y'all, I'm telling y'all, be safe. Don't partake in this circus atmosphere that these people are out here. Look, P.T. Barnum said a sucker is born every minute, and don't be a sucker. That's all I can say. Okay. According to the court documents, Mozzie offered homeoprophylaxis immunizations for childhood illnesses that she falsely claimed would satisfy the immunization requirements for California schools. Okay, putting kids at risk. Wow. and falsified immunization cards that were submitted by parents to California schools. Homeoprophylaxis involves the exposure of an individual to diluted amounts of a disease purportedly to stimulate an immune system, stimulate the immune system and confer immunity. Wow, man. Mozzie is alleged to have falsely claimed that orally ingesting pellets with small amounts of COVID-19 would result in full lifelong immunity from COVID-19. Okay. I mean, did anybody stop to ask her, where did you get the COVID-19 from? How did you obtain, this to, make these homeoprophylactic, pellets that you're out here peddling, there's so many questions that should have been asked by a person who has, common sense, at least a high school education, junior high school education would have sufficed. This doctor violated the all-important trust of the public, This doctor violated the all-important trust the public extends to healthcare professionals at the time when integrity is needed the most, said Special Agent in Charge Stephen J. Ryan. The Department of Health and Human Services Office of Inspector Generals is working closely with our law enforcement partners. Our agency will continue to investigate such fraudsters who recklessly endanger the public's health during this unprecedented COVID-19 crisis. The affidavit alleges that Mozzie used the COVID-19 pandemic to expand the pre-existing immunization scheme by selling immunization pellets that she fraudulently claimed in written documents and consensually monitored recordings would provide lifelong immunity to COVID-19. Mozzie explained that the pellets contained a very minute amount of this COVID-19 disease that can result in infectious symptoms of COVID-19 or automatically flag the immune system's attention, inducing immunity. To encourage customers to purchase the pellets, Mozzie allegedly exploited disinformation and fear by falsely claiming that the FDA authorized COVID-19 vaccines contain toxic ingredients. Mozzie further stated that her customers could provide the pellets to children for COVID-19 immunity and that the dose is actually the same for babies. Now that is dangerous. If there was something in there, the dosages for children are based on, their weight and other factors. And it's not something that is very, that you can play with, pediatrics is something that you have to really spend time studying, especially administering medications during that time, the vaccinations, all of that. That is a specialization, and a lot of people don't make it through school based on peds, and it is tough. So that being said, they're gonna come down on her for saying that, oh yeah, you can give this to kids. No, you don't ever put a child at risk, and she did that willy-nilly. Spreading inaccurate information or false medical information about COVID-19 for personal gain, as the complaint alleges, is dangerous and only seeds skepticism among the public, which is at an all-time high. I mean, it's like nobody believes anything right now. I mean, and it's at toxic levels. I don't think we're ever going to recover from people's lack of belief in science and medicine at this point. It's tragic, but let's move on. Said Special Agent in Charge Craig D. Fair, the FBI San Francisco field office, as the government continues to work to provide current and accurate information to help slow the spread of COVID-19. The FBI will continue to pursue those who attempt to fraudulently profit from the spread of misinformation and providing false documentation. Mazi also provided CDC COVID-19 vaccination record cards to her customers with the instructions on how to fraudulently complete the cards to falsely make it appear as if the customer had received 2 doses of the Moderna vaccine. As a part of her scheme, Mazi provided customers with specific Moderna vaccine lot numbers to enter onto the cards and with instructions on how to select the purported dates on which they received the Moderna vaccines to evade suspicion. And she probably had help from someone who had the vaccines to actually provide those lot numbers, which means that this is going to be probably going to encompass some other people being arrested, which is a shame. But, we're seeing some of the same stuff that was going on with the Houston doctor in trying to evade giving people the vaccine. And just the amount of treachery that they engage in. And then they try to make it seem like there's just some altruistic motive for why they're doing it. And it's about money and taking advantage of people's stupidity. Okay. All right. The trial attorney, Sridhar Babu Kaza of the Criminal Division's Fraud Section's National Rapid Response Strike Force, and Assistant U.S. Attorney Christian Highsmith of the U.S. Attorney's Office for the Northern District of California are prosecuting the case. The case was brought in coordination with the Healthcare Fraud Unit's COVID-19 Interagency Working Group, which is chained by the National Rapid Response Strike Force and organizes efforts to address illegal activity involving healthcare programs during the pandemic. Okay. The fraud section leads the health case fraud strike force since its inception in March 2007. The healthcare fraud strike force, which maintains 15 strike force operating in 24 federal districts, has charged more than 4,200 defendants who have collectively billed the Medicare program for nearly $19 billion. In addition, the Health and Human Services Center for Medicare and Medicaid Services, working in conjunction with the HHS OIG, are taking steps to increase accountability and decrease the presence of fraudulent providers. So they're snake oil hunters. I like them. All right. In May, the Attorney General established the COVID-19 Fraud Enforcement Task Force to marshal the resources of the Department of Justice in partnership with agencies across the government to enhance efforts to combat and prevent pandemic-related fraud. The task force bolsters efforts to investigate and prosecute the most culpable domestic and international criminal actors and assist agencies tasked with administering relief programs to prevent fraud by, among other methods, argumenting and incorporating existing coordination mechanisms, identifying resources and techniques to uncover fraudulent actors and their schemes, and sharing and harnessing information and insights gained from prior enforcement efforts. For more information on the department, blah, blah, blah. Okay. I hope you guys found this interesting. I find it interesting that there are snake oil hunters out here, and they're roaming about trying to, rein in some of these flat earthers and, science deniers and rebel rousers. It's been fun, guys. I hadn't done a medical story in a minute. I've been doing some other stuff here. Hope you guys like that too. My It's All Connected, series there. And let's see, it's pretty serious, but these guys, they look pretty, silly out here taking advantage of people like this. And then you don't know what these people are giving you. They could be poisoning you. They could be giving you, crushed up berries in rat turds. You don't know. They could be giving you anything and you'll take it. But then you justify that in your mind that you won't take something from a doctor that's went through a process to make sure that what's in it is what's in it, and that it's safe for, human consumption or injection or however it's administered. Don't be silly, guys and gals. Do your homework. There's too much information out here for you to reputable information. Let me go back and say that reputable information for you to partake of in order to make your decision as to whether you're going to do this or not. And even if you're not going to do it, there are measures that you can take that you can prevent, as best you can from being infected, which is wearing a mask, making sure you wash your hands, making sure you're not in close proximity to large groups of people. And definitely, staying out of crowds of people who openly confess to not believing in COVID and whatnot. Just don't even, put yourself at risk. Don't put your family at risk, because if you don't believe me, all you got to do is just go off into some of these places or, chat rooms and whatnot where blog spots where some of these ICU nurses and ER nurses and doctors are discussing what they're seeing and how horrified and overworked and tired they are. Some of them to the point. I mean, you had doctors in England that were saying that they will not do it again. People are out here not listening and not doing what they need to do to keep themselves safe. So there are other measures out here that are being put in place to where if you choose to not get a vaccine, you choose to not be treated. They will not treat you if you come to the hospital. And you got some people here who are saying that they are going to pretty much take it that you waived your rights, to be treated if you've had you've denied your a COVID vaccine when it was offered to you. And in that case, they're just going to send you home. You know what I mean? Send you home and let you rough it out. And that's unfortunate. If you ever seen this stuff in action, it's not a good situation. But I won't ramble on. I appreciate everybody, checking me out and, listen to the stories that I cover. I appreciate everybody. Thank you guys. Please like, share, and subscribe. And,
You are listening to Abuki Cabal, the analytical savage.
see you guys the next time.
I feel like a motherless child alone.